joining us for this meet and greet with Dr. Robbie. You can probably feel my excitement through the Zoom. I hope you can. I am a maternal health advocate with a focus on postpartum mental health, disparities in outcomes, and equity in healthcare. I am so excited to be hosting this event on behalf of MARC, which is the Milton Anti-Racist Coalition. This group was formed in June after a beloved English teacher named Zakiya Jarrett was wrongly suspended from work when she was teaching her sixth graders about police brutality and racism. It was actually a very sad situation in which her lesson was recorded by a parent and sent to other people, and she was wrongfully suspended. She eventually got her position back, but it really stirred something up in the town. And I see that we have a member, Scott Matthews. He's one of the founding members of MARC, is with us tonight. So Scott, if you want to add in something later, put it into the chat box, and I'll be sure if you have a question or a comment about MARC, that would be great to add into it. So one of the reasons that I'm so excited tonight is because as a maternal health advocate, you know, I understand how important it is to actually have doctors using their voices on behalf of patients in order to enact legislation that improves outcomes. So when I met Robbie, it was very clear to me that he had empathy, compassion, intelligence, but he also had really innovative ideas that I really feel like could lead us into just this 21st century thinking that we all need to have right now. And he also is just so concerned with meeting basic human needs, things that we all deserve, and a true commitment to human rights. He has dedicated himself to helping patients living with HIV and AIDS, and he also founded the Transgender Center at MGH. So I could go on and on. Robbie, you know how much I love you. I'm like about to jump through the screen, but I'm gonna stop now and you can tell everyone about yourself. So I'll turn it over to you. Thanks so much, Dr. Robbie, and thanks everyone for being here.
Amazing. Thank you, Tamari, for the introduction. And for people who don't know me, there's a lot on the call that I think do, but for people who don't know me, I'm Dr. Robbie Goldstein. I'm a physician at Mass General Hospital. As you heard, I'm an infectious disease doc, and I'm running to be the next representative for Congress here in the 8th Congressional District. I will say that I've been in this race since November. It's been a long road. In some ways, it felt like it flew by, and in other ways, it feels like it has crawled at a very slow pace. But when we started in November, the conversation we were having, the phrase that I was saying was that I'm in this race to fight for access, equity, and opportunity for every person in every community. And that message has continued all through this campaign, has taken on tremendous meaning as we talk about COVID-19, has become incredibly important when we address the racism that we are seeing all across our society in the response that has poured out all summer long. So it is at the core of this campaign, that message. I do want to share a bit about myself for people who don't know me, but we should spend most of tonight with questions and answers and a discussion, a conversation. That's the best part of this. But for the people who don't know me, I'll tell you briefly. I grew up in a small town in upstate New York where my dad was a dentist and my mom managed the office. And what they ran was a family business. It was a business that cared for the community that we lived in. And it's a business where they invested in their neighbors every day. And that work inspired everything that I do. I came here to Massachusetts 20 years ago to go to college. I stayed to get an MD and a PhD, and then went over to MGH to do my training in internal medicine and infectious diseases. And I knew throughout all of it that what I wanted to do was exactly what my parents did. I wanted to care for a community. And so I became a primary care doc. And I became a doc for folks living with HIV, people in the LGBTQ community, and people affected by substance use. And that work has been tremendous over the past 10 years, building that practice, working with people every day, sitting with them in the exam room. I've recognized in that work that I certainly talk to my patients about health insurance and healthcare access. It's very important. But more often, we talk about food security, and we talk about housing. We talk about racial justice. We talk about jobs. We talk about issues that they're facing every day in their lives outside of the exam room, and how those impact their ability to live a healthy life. And so I got into this race because I think we need to fundamentally address the healthcare system and recognize that healthcare is so much more than just an insurance card in everyone's pocket. Healthcare is about all of those other social determinants of health and how we can improve on each of those. I'm running in this district against a fairly conservative Democrat, someone who voted against the Affordable Care Act back in 2010. I believe that healthcare is a human right and that we have to work every day to expand access. I'm running against someone who is pro-life and who has not supported maternal health and reproductive justice in the way that we expect someone from Massachusetts to fight. And I believe firmly in the fact that we need to fight every day for reproductive justice and make sure that we're expanding access for people. But I think the biggest difference between myself and Congressman Lynch, who I'm running against, is my view of government and my view of leadership. I believe in bold leadership. I believe in big changes. I believe that we can address the challenges that my patients are facing. We can move forward if we all work together. And I got into this race because I think this district deserves a representative that shares its values and isn't afraid to lead with those values every single day. So I'm going to leave it there. There's a lot more that I could share, but the best part about the night is the conversation. So I'm going to maybe pass it back to Tamari and we'll have a conversation and we'll see where this goes.
Great. Thanks so much, Robbie. So as a maternal health advocate, really one of the most pressing things for me is just trying to assess what mothers need, all different types of mothers. And we rarely hear about mothers with HIV or AIDS. It's almost like a forgotten population. So if you could speak a little bit about what you're hearing from your patients who are moms with HIV and AIDS, what needs do they have that are currently not being met?
Yeah, tremendous needs. And I can name the specifics, and I think we should talk about their ability to access safe and effective medications during pregnancy. We actually have very few medications that have been studied in pregnant women and those living with HIV. We can talk about their access to testing and anything that their baby may need, either before or after delivery. There are issues around healthcare itself for women living with HIV and whether or not they can access prenatal care and all of the care that they might need as they're going through their pregnancy. But I actually think that the biggest issue that encompasses all of that is stigma. There is still tremendous stigma in this country around HIV, and specifically for women living with HIV. We know that there are so many women in this country who are not able to share with their partners their HIV status because of the stigma that exists. They are not able to have a conversation with their healthcare provider around HIV prevention because of the stigma that exists. And when I talk to folks in my practice, it's about breaking down stigma, breaking down those barriers, and making sure that people do have access to HIV prevention services like pre-exposure prophylaxis, a pill that someone can take every day to prevent the risk of HIV transmission. That they have access to the perinatal care that they may need so that they can have a safe and healthy pregnancy. I think it is important that we continue to work on that stigma piece because it exists and exists everywhere in this country. It certainly exists here in Massachusetts where we have made a lot of enormous steps forward, but we still have a lot of stigma. And if you allow me, I'm just going to add in one other piece, which is that I work with a lot of folks living with HIV and we talk about that, but there's actually a lot of infectious disease concerns that come into pregnancy. And we are seeing that there's a resurgence of a lot of things like syphilis, a diagnosis that we didn't think about for many years, but we're actually seeing a recurrence of maternal diagnosis of syphilis and congenital syphilis transmission to the baby. We are seeing, with COVID-19, there's concerns about pregnant women and children and how we're going to manage what folks need when they need their perinatal care, when they need to come in for all of their visits, if they need to come in for their delivery. There's a lot actually of that intersection of infectious disease and maternal health that we have to keep talking about and keep working on.
Thank you. So we've got some questions into the chat box. So one is from Georgianne. Georgianne, thanks for joining us tonight. Her question is, well, first she says she wants you to know that she's a big fan of Andrew Yang. So that's the first thing.
Okay.
And she wants to know, why is Andrew supporting you, Robbie?
Yeah. Well, so Andrew Yang was one of the first people who endorsed the campaign, which was back in, I guess, probably April when he officially endorsed the campaign. And we had a great conversation. Andrew Yang and I were able to have a conversation on the phone. It was about 45 minutes long. And the reason that he decided to support this campaign is that he saw the importance of bringing someone to Washington who can talk about data and evidence. Andrew Yang built his presidential platform on data, on math, making sure that we're using facts to drive decisions. And that is exactly what I talk about every day on the campaign trail. I talk about using the available data to make sure that we're making the right decisions. But also, and this is something that Andrew talks about too, is marrying that data with the stories of individuals, recognizing that you have to listen to communities, you have to listen to people. When you listen to people, you have to take that and put it together with the data to come up with the best plan. That's how doctors work. That's how I manage my patients in the exam room and in my practice. That's also how government should work, is sort of pulling together the stories of communities and the data that are available.
Well, I think, what tends to happen a lot, because I see it all the time in maternal health, is that, we listen to people, we collect the data, and we lack the action piece is always the thing that we're still hoping and waiting for.
Yes.
Scott Matthews has a great question that sort of segues into that. And so he's asking, can you expand on some examples where you will expand access, equity, and opportunity?
Yeah. Well, let's talk about healthcare first. I mean, I think that's one of the best examples of where we can actually do that, right? So we can do that by guaranteeing everyone access in this country. We can do that by controlling the cost of care in this country. And when we do those two things, it will actually improve equity in this country. Just to give you an example of that, right? We know that in this country, while the Affordable Care Act was a huge step forward, it still left a large percentage of folks in our country without health insurance. Those people are predominantly Black and brown people in this country. And you can go further and say most of those people are living across the south of this country. And we have to make sure that we provide those people the care that they need. So we've got to expand access. When we expand access, we will almost instantly begin to address some of the racism and the discrimination that exists in healthcare. We also have to think about cost, right? When we fix the cost parts of healthcare, we know that lowering the costs, controlling the prices of prescription drugs, getting rid of co-pays and co-insurances, and all of the other pieces that go into healthcare billing. And when we do that, we are going to have a disproportionate impact on Black and brown communities who have not been able to access the care that they need. So that is how we can be very specific about fixing the equity issue while we address access and while we address costs. But it's not, we can't just do it in healthcare, right? We've got to do it in every part of our society. We have to think about, for instance, if we think about education, think about universal pre-K, right? Universal pre-K, I think, should be available to everyone in this country. The reason we need to invest in it is because the people who aren't able to access pre-K right now are oftentimes single Black moms who don't have the resources to pay for pre-K. When we make sure that that is provided to everyone in this country, we are going to lift up the Black women in this country, make sure they have what they need, and make sure that everyone is starting kindergarten on a level playing field. Everyone is able to move forward together, right? So we have to be very intentional about each of the actions that we're taking and think about what are the consequences, what happens downstream, and how does that address equity.
Scott also would like to know what town you grew up in New York.
Oh, I grew up in a town outside of Rochester, New York called Pittsford, New York.
You know it, Scott? So speaking of the equity piece, and getting back to what we experienced here in Milton with Zakiya Jarrett, the teacher I was describing at the beginning of our meeting, how do you feel like you'll be able to use your position as our congressman, to help the communities you represent deal with these issues that come up in the schools?
Yeah.
Because for many parents, we see these issues start very young, kindergarten, first grade, and then they continue to escalate. And children are on the receiving end of not just the behavior of other children, but also other adults. So how do you feel like you could partner with schools and communities? Do you believe that anti-racism is something that should be taught in schools? And how do you feel, what would be your role in that?
Absolutely, we should be teaching an anti-racism curriculum in schools. And I think what's really important is to recognize with what Zakiya was doing was absolutely right. She was teaching people true history. She was teaching people true acts of racism that exist in this country. But she wasn't saying that all people are bad people. She was simply saying that this is the reality, this is truth. There are unconscious biases. There are pieces of our society that remain deeply racist and deeply involved with discrimination. We have to name them, because until we name them, we can't address them, right? So the federal government actually has a tremendous role here. largely because the federal government provides a lot of funding for schools, for the public education system. And that funding comes always with oversight, regulations, with standards. And the federal government should be making sure that that funding is coming with a commitment to an anti-racism curriculum, a curriculum that would span from kindergarten through 12th grade, a curriculum that will build upon itself so that people can be taught appropriately at all stages of their development. The federal government then has to do the oversight to make sure that that's being rolled out across the country appropriately, and that it's being taught appropriately, and that objective measures are being hit by school districts. I think we're going to see, as anti-racism curriculums actually do spread across the country, they're going to be taught differently here in Massachusetts than they are potentially in Alabama or in Wisconsin or in Arizona. And so we have to think about how we make sure there are some standards, but also that they're tailored appropriately to the region, to the state, to the district that they are in.
Have you identified individuals that you would like to work with once you become our congressman, people that you feel are aligned with your, the missions and goals of yourself and the district that you represent, our district, Massachusetts 8 here? And who are those individuals, and why are you excited about working with them?
I will say I've definitely thought about this, and this is my favorite question. The number one person that I'm excited to work with is actually someone who's not from Massachusetts, but it's Congressman Lauren Underwood, who is from Illinois. She's a public health nurse who 2 years ago came into Congress and has, I think, had a tremendous career in just 2 years, where she's made amazing change and moved the country forward. She's brought her public health background to Washington. She talks about healthcare expansion and how we can shore up the Affordable Care Act, really important pieces of legislation that she's introduced. But she also talks about voting rights, and she talks about racial justice, and she talks about so many other issues that she understands from her public health background. And she's done something in Washington, which is that she's built amazing coalitions around her of folks who are very far to the left and in the progressive wing of the Democratic Party, and those that are in the center of the Democratic Party. And she's brought people together to push forward with her agenda. And I would be excited to work with her. I am probably her ultimate fan, and probably her number one in her fan club. She doesn't know that yet, but she'll find out as soon as I get to Washington. But I also think
I'm going to tell her tonight.
Yes, please do. But I also say I'm very excited to work with Congresswoman Presley, and I think that there is a really unique relationship between the 7th Congressional District, hers, and the 8th Congressional District. They're side by side. They share many, many borders, including in Milton and in parts of Boston and in other parts of the district. And I think it's really important that there's a strong partnership between those two districts. They're the two districts that represent Boston. They're the two districts that have a tremendous amount of the population of Massachusetts. There's a lot of work that can be done to improve the communities if we work together.
Absolutely. Now, how do you see yourself being someone who can work across the aisle? Things are so divisive nowadays. What qualities do you feel like, you have that will best help, bring us all together? And can you identify people that are across the aisle that you'd like to work with, moderates as well as conservatives?
I'll say I will work with anyone on any side of the aisle as long as they believe in facts and data. And that is sometimes hard to find on the other side of the aisle. It's sometimes hard to find people who believe in the data and who will talk in facts. But that doesn't mean that I won't have a conversation with them. I didn't talk about it in the beginning. You did share that I established the transgender health program at MGH, and part of that work was going door to door in the hospital and talking to people who I probably, before I walked in, knew that they weren't going to be supportive of the transgender health program. And I still walked in the door. I still sat down. I had the meeting. We talked about why I thought it was so important. And I walked away at the end. And it was about getting my position out there. It was about showing people that I believe in this, that I know this is the right thing to do. It was about sharing my data and my facts and my evidence, and recognizing that I can't presume, really, that anyone is going to be on one side of the issue or not. So I'm happy to talk to the Republicans in Washington and the Democrats and the progressives and the libertarians and you name it. I'll talk to anyone about any issue as long as it can be a conversation based in facts.
Great. So we have a question from Robert Saba in the dining room downstairs. Since the start of COVID, we've seen unemployment go up significantly. People are struggling with food insecurity. Many people may not be able to pay their rent or mortgage if they don't get help soon. What do you think of the government COVID response so far? And what else do you think can be done? Thanks.
Well, I think the CARES Act and the HEROES Act were the bare minimum of what the federal government needed to do to try to get us back on track. The HEROES Act still hasn't passed the Senate and is sort of stalled. But I think that we are missing opportunities to make sure that this country can continue to really survive and in some ways to thrive through the COVID-19 pandemic. One of the things that I talk about a lot, I know we have an Andrew Yang fan on the call, is I talk about emergency cash relief a lot. And I think if you go back to the beginning of the pandemic, we provided $1,200, a one-time payment for some folks in this country. And that was not nearly enough money to make sure that people can pay their rents, people can put food on the table, people can get their kids ready to go back to school this fall if they need something. They make sure that people can continue to subsist during COVID-19. And in the HEROES Act, there's no real mention of additional emergency cash relief or additional payments that will take that burden off of people. Right? We have an opportunity right now to take the burden off, to make sure that people can pay their rent, so that landlords can continue to pay their mortgages, so that we can continue to move forward even as people are out of work and so much is going on. So I think there's a lot that we can continue to build on. I will say that my biggest frustration right now is that Congress is on recess, that the House and the Senate have gone home for the rest of August, while millions of Americans are out of work, millions of Americans don't have health insurance, millions of Americans are diagnosed with COVID-19, thousands of people are dying every day, and we don't have Congress in session to even negotiate a bill and try to move something forward. And I think that we need to recognize the urgency. The American people know the urgency. We're watching people, we're watching friends and family get diagnosed, friends and family lose their jobs. Congress needs to recognize that urgency too.
Yeah. So we have another question from Scott, and he writes, you would be coming in as one new person of a body of 50 and hopefully in the majority party. What efforts do you see yourself being able to do to roll back some of the rollback of the Affordable Health Care Act? Also, how would you be able to help expand anti-racist teaching?
Well, an individual congressperson has very little ability to move things forward on their own. And it is about building coalitions and building power in numbers. And I think that's the important thing first, is to do that door knocking, to go door to door, meet people, talk to them about issues, and try to build a team so that we can actually address healthcare. There are certain areas in healthcare that we could act now. I don't think we will. Congress isn't even in session, so it's hard for them to act upon them now. But we could certainly act in January 2021. And they have this full support of the Democratic caucus, most of the Democratic caucus, I should say. And they should be signed by President Joe Biden if he's elected in November. Those are things like expanding Medicaid in all 50 states. And that will really dramatically improve access to healthcare and equity in healthcare. That is lowering the age to get onto Medicare, which will increase the number of people who can be on the Medicare plan and may be able to uncouple health insurance from their job. It's reopening the Affordable Care Act exchanges, which was actually done through executive action and not through the legislature. But the Trump administration really closed down and narrowed down the window to sign on to an Affordable Care Act plan, which gave people not a lot of time to get onto a health insurance plan if they needed health insurance. Those are the ways that we can really instantly, within days, improve access to healthcare in this country as we're facing the pandemic.
Get to Scott's second question. I just want to go back to your mention of team. So I'd like for you to talk about, Robbie, who's on your team? What does this roster look like for you? Your first day on the job, who's next to you? Who are you talking to? What are you gonna
Well, I hope it's Lauren Underwood and I hope it's Ayanna Pressley. I also think that there's a growing progressive caucus that's going to be pretty big in the next Congress. And I think of those people as friends. I think of those people as people that I would like to talk to on day one. Some of them are people who have been there for a while in the Senate, people like Senator Warren, people like Senator Sanders. In the House, it's also people who have been there for some time, but there's a lot of new people that are coming in. Richie Torres out of New York, Mondaire Jones out of New York, Jamal Bowman out of New York, Marie Newman out of Illinois. There's a lot of progressives that are coming in. And I think they're the initial team, right? They're the first people that you pick up the phone and you say, I know we're like-minded. I know you'll agree with me. And so let's start this now. But that's only day one. Day two has to be the people that are outside of that, right? It has to be the people that are a little bit further to the right, maybe a little bit more moderate or a little bit more conservative than I am. And that's bringing in the rest of the Massachusetts delegation. Many are strong progressives, but not all. It is bringing in more folks from really hard hit areas of this country, folks from Alabama and Georgia, from Florida and Texas, states that have seen really high numbers of COVID and who recognize the importance of healthcare expansion, right? It's working through that delegation one at a time. And it is recognizing that the team is going to keep building because I'm going to keep knocking out doors. I'm going to keep going into offices.
And then locally, how will you work to make sure your constituents feel like they're a part of your team? So, how will you partner with communities and make sure that they also feel like they're a part of all the initiatives you want to take on?
Well, that is what representation should be, right? Representation in Washington is about bringing the stories and the voices of communities to Washington. And so to do that, that means talking to folks like you, talking to folks that I know from Mass General, talking to folks that I know through things like BAMSI down in Brockton, or Health Imperatives across the South Shore, or, all of the health organizations, if we're talking about healthcare expansion, right? Talking to those folks on a daily basis, making sure that I'm understanding what it is the problem that exists on the ground, what are the proposed solutions, and when I write the bill, what actually does that bill do to improve the problems that exist and to address those solutions that were proposed. It's a back and forth in a conversation, right? So it can't exist in, I'm going to show you the bill and you get to just give me a thumbs up, thumbs down. It's got to be a back and forth working process where pieces of that bill maybe get written by folks at BAMSI and Health Imperatives because they know how that's going to improve the lives and the health of people in Brockton. Folks like you are helping me craft the language about how we're going to improve the lives for women and for mothers in the Boston area and in Massachusetts, but also all across the country. There's got to be a back and forth in the process.
Yeah. So Scott has another question about how would you be able to help expand anti-racist teaching?
Well, so some of it is what I was saying about federal investment and making sure that federal funding is linked to that anti-racism curriculum. But it's also recognizing that it's not enough to address racism in only one sector of our society. So I do think the federal government needs to invest in an anti-racism curriculum, into building that curriculum, in finding the right experts across the country to make sure that we are creating the right standards and the right program, that we're coming up with the right objectives that we need to measure. But it is thinking outside of education, right? So what does it look like in the community programming that exists in communities all across the country to make sure that those programs exist and are also able to sort of pick up when kids get out of school, the anti-racism curriculum and the anti-racism work? What does it look like in the housing system? And how do we make sure that we're bringing in anti-racism policy to our housing structure and our affordable housing investment? What does it look like in the healthcare system? What does it look like in transportation? Making sure that in each of those, we're thinking of, I'll use the same word, an anti-racism curriculum, but it's really anti-racism policy, so that no matter where you're going in this country, we are all moving forward to an anti-racist future from our very racist present.
And how do you plan to respond to pushback from that? In these times, we definitely receive pushback when we want to take on these challenging topics and important issues in our world. So how will you respond to pushback?
Yeah, I think we're seeing a lot of pushback right now, right, with the Black Lives Matter movement, and we see these factions that pop up, even here in Massachusetts, really pushing back on this idea that we have to move into this anti-racist future. We have to address the racism that exists. Part of it is being louder. Part of it is by having a bigger coalition. And this past Sunday, I went to Hingham, where there was a rally for Black Lives Matter. And I had to pass by a Blue Lives Matter rally. And it was, I have to say, a very small group of people that were very loud. And it gave me more energy to go to the rally and be as loud as I possibly could be, because I think we need to be louder and prouder and out there with our beliefs and pushing forward. So that's part of it, right? It's just being loud and having the strength to stand up. But it's also having those difficult conversations, right? If I had had more time on Sunday, it actually probably would have been more effective for me to stop and to have a real conversation with the folks at the Blue Lives Matter rally, just as much as I had real conversations with the folks at the Black Lives Matter rally. And it's to talk to folks about, what is it that you're seeing? What is it that you are afraid of? What is it that you are nervous about? And how can we allay those fears? How can we help you understand why this is an important issue and why we have to do this together? It's a lot of it is one-on-one conversations. A lot of it is leadership in these conversations. We don't have that right now in Washington, I think, leadership around the Black Lives Matter movement, at least not in the presidency and in the executive branch. So we've got to work at this at the very hyper-local level, and then at the broader level as well.
Are you the guy that we can count on to walk the walk with us, and meaning literally, back to the situation with Miss Jarrett, when we, have rallies and protests, when we want to show up at school committee meetings and things like that. And we say, Robbie, it would really be helpful to have your presence here. We need you with us. Are you the guy we can count on to be there?
Absolutely. Absolutely. And I will say I have been the guy who's been there in this congressional district for the past 9 months, even before that, right? I was the guy who was there for Black trans women who needed care and needed access, and who was sort of standing with them and marching with them and working with them to create the access that they need. I think it's really important to show up, but it's also really important, and I will say this has been my task over the past 10 months of the campaign, but my task in building the transgender health program, is that it's not about showing up and taking the mic. It's about showing up and listening. It's about showing up and standing there in solidarity, standing there to support and to raise up the issue, but then listening to those people that are in the community, that are part of this movement, and making sure that I'm learning from that process. Because that's how I can then bring those lessons to Washington, right? That's how I can represent those folks appropriately.
Thank you. So we have a question from Kyle. As parents manage their children's diet in areas where COVID continues to restrict on-site education, i.e. school lunches, how do we build capacity to be able to replace environmentally taxing food production industries, such as cows, chickens in their own poop, etc., into food that is both nutritious and delicious? And then he writes, Green New Deal food.
Yeah, I love that description, Kyle. Right. I mean, this is food security at its core. Food security. So much of our ability to make sure that people have food security is making sure that we have school lunches that are healthy and nutritious. Right. Making sure that people can access breakfast and lunch when they're at school. And again, this is where the federal government has the ability to really lead, because they can actually invest in that space. They can invest in making sure that people have healthy food. They can put oversight and restrictions on what schools are able to spend their money on, to make sure that we are investing locally, right? We're making sure that the local farms and local producers are able to get their food into the public school system, making sure that the food that is going into the public school systems is healthy and nutritious. There's great examples of this, right? And this is like one of those things of using evidence to drive our decisions. But these public schools all across Boston, but 7 all across the country, that have their own gardens and their own curriculum around teaching about how do you grow food, how do you take that food and then create a healthy meal from it, how do we use that food in the cafeteria, how do we connect to this so that we're teaching and providing lessons and helping to build a healthy future, while also improving at that moment the lives of folks that are in the school.
Thank you. Let's see, so we have a question from Robert Saba. What are your thoughts on K through 12 schools opening in the fall? Many schools are leaving it to parents to choose between full remote or a hybrid remote/in-school model. Do you think this is a good idea?
I will say I don't know, I should know this, but I don't know the specifics about what Milton has decided to do. I know from Boston and Brockton and some of the other parts of the district, but there's no right answer here. There is no right answer in how to move forward with K-12 education. I think the things that we need to remember are, one, that plans are going to change day to day. As the number of cases change in a given district or given town or a given neighborhood of a town, there will have to be changes to the plan that gets put in place. The second that we have to remember is that it's not just that we need to worry about students. We have to think about students, we have to think about their parents and their family, we have to think about educators, we have to think about school bus drivers, we have to think about how all of these plans are going to impact all of those different people. And while a hybrid model or a fully virtual model may be best for the students because it keeps them from exposing themselves to other students and maybe getting the infection or spreading the infection, it may have really significant impacts on parents. And the hybrid model may have really significant impacts on teachers. And so we've got to make sure the right people are at the table. One of the issues with the plans right now is that the Boston Teachers Union, the Massachusetts Teachers Association weren't included in the discussion around how to open safely. And that has resulted in a lot of frustration around the plans that exist. So those are the two things that I think we have to keep in mind. I would say that I get asked this question a lot. If I had kids, what would I say? And how would I want my kids to be educated in the fall? And I think I recognize the importance of in-person education. I think teachers are amazing and have skills that parents don't have because parents haven't gone to school to learn how to be educators. That just isn't their job. And so we need to allow teachers to do the work that they do really well. They do that well in person. And I think that there is a role to bring kids back to school and to get them back into the classroom. That can only happen if students have access to masks and teachers have access to masks, that we have enough testing, and that we've invested in the contact tracing that we need in each school district, in each jurisdiction, so that we can make sure that as outbreaks maybe happen, we can quickly shut things down. Unfortunately, I haven't seen us have enough masks across the state. I haven't seen us have enough tests across the state, and I haven't seen us invest in the public health. And so it worries me, and I think we need to be relying a lot on virtual education, at least for the first few months of the school year.
Thank you. There's a question from Robert. Last weekend, I visited my parents, and now they plan on voting for you, Robbie.
Yes.
What are you doing, and what else can be done to turn out support? So, Robert, I want to call you Bob so bad, honey. What I'm thinking is your question more around the age group, like drawing out older voters, or just in general support? Okay, so just in general, but I would also like to know in particular amongst older voters, and then sort of segue that into Lynch supporters. How are you turning them onto you?
Yeah. Well, I will say that we have less than 2 weeks to go until the primary, and we are doing everything we can possibly do to get in front of as many voters as possible. That means that we are on the digital airwaves, blanketing the digital space with ads. We have sent out 3 mailers already to mailboxes across the district, and we're about to send out our 4th mailer to make sure that my name and my face and policies are in front of everyone as they go to vote. We are making phone calls every single night all across the district to try to talk to as many people as possible and persuade them and share with them the issues that are present in this campaign. And I will, if Nina doesn't kill me for saying this, because it's going to happen tomorrow morning, we will be launching our first TV ad tomorrow to homes all across the district, which will get us in front of a lot of people. We have a strategy, we have a way to get in front of as many people as possible. We are really trying to rely on the message of the campaign, talking about the very clear differences between Stephen Lynch and me, right? Talking about healthcare, talking about reproductive justice, talking about leadership, because we think it's the best argument that when people see the two of us side by side, it's a very clear choice. That's true in any age group, but we've recognized that older individuals tend to get their information in certain ways. That is the mail and that is TV. And so we have to be there to connect with them. Younger folks are on their phones all day and they're on their iPads and they're seeing the digital ads. They're also the ones who are getting our text messages and sometimes answering our phone calls and things like that. So we're trying to make sure that we're connecting with people all across the district at all different ages in all different cities and towns.
As you've gone around to the different towns, What are some of the concerns you've heard from older residents?
So it's really interesting. There's a lot of folks who have moved out of Boston and have moved to the South Shore, who moved down to communities around Brockton, or even moved out to suburbs like Walpole or Dedham. And when I talk to them, they know Stephen Lynch, they know Congressman Lynch, but they also know that they were upset with him in 2010 from the Affordable Care Act. Even folks who are on Medicare right now and who recognize that they have health insurance and it is being provided through the government, but they're upset about the Affordable Care Act. There's a lot of older folks who are also really upset around reproductive justice and reproductive rights, and who have lived in Massachusetts their whole lives, have lived in a blue state where they expected the Massachusetts delegation to push forward on reproductive health care, and they've been disappointed that Stephen Lynch has remained pro-life and has not been an ally and an advocate in this cause. There are a lot of folks who talk to me about traffic and transportation. And I think that's because a lot of people drive around, even old people are driving around. This is all before the pandemic. Now most people are staying at their homes, but and it's a big issue. And I actually think it's great to talk to these people because they have this experience in the Boston area of a time when there was no traffic and the subway worked really well, to a time when the subway doesn't work at all and you can't get anywhere across Eastern Massachusetts in less than an hour. And so we talk about those issues a lot in ways that we could potentially improve the transportation system.
Thank you. Scott has a question about BIPOC constituents. What are some of the concerns you've heard from your potential BIPOC constituents?
Yeah, so, I'll call out in particular the conversations that I have in Brockton. Given there's a huge Haitian community in Brockton and a Cape Verdean community in Brockton. And for many of those folks, it is the impact of systemic racism is incredibly real. It is felt every single day, every single moment of every single day, as they walk around Brockton, as they go to school, as they go to work, as they try to receive healthcare. It is not a coincidence that in this district, in the 8th district, Brockton has the highest level of COVID-19 cases. It also has the highest amount of air pollution. And so for folks in Brockton, when we have conversations, it's about justice. It's a conversation about how do we make sure that environmental plans bring justice to the Black and brown community that exists in Brockton? How do we make sure that our healthcare plans bring justice to the folks in Brockton? How do we make sure that the education that folks are receiving in Brockton is anti-racist, and that they're able to exist in a society, exist in a community where people are having those conversations around racial justice? I've really enjoyed every time that I get to go down to Brockton, because I think I get to learn a tremendous amount when I'm down there. I was down there last week, and I went to a little cafe, and we had this amazing conversation around the PPP, the Paycheck Protection Program for small businesses. And the cafe said we weren't able to access anything. And it sort of went through the steps that were required and the reasons why a Black-owned business were excluded from the Paycheck Protection Program. And it was really important for me to hear, right, and to learn and to recognize we could have written that bill better. We could have passed a better plan. We could have had better oversight. We could have had better regulation on the way that the money went out through PPP, so that Black-owned businesses had access to the funds and could continue to exist. We were standing in his shop, and he said, this business next door, they had to shut down. This business is about to shut down. And they were all Black-owned businesses that were right there in Brockton that just couldn't access PPP. What
concerns have you heard from youth?
I don't want to sound too cliche, but kids talk to me a lot about climate change. And it's an issue. I think that it is very clear that there's a generation that is so focused on this climate fight and the urgency of the issue. It has been really remarkable, though, to see the young folks that are out at Black Lives Matter rallies across the district. The one that I talked about in Hingham this past weekend was run by a group of amazing kids. I say kids, they were all 18, 19, 20. I think they're young adults, not kids, but amazing folks who were out there rallying. And they all, I have to say, came from the sort of Sunrise movement, the environmental organization, that movement to address climate change. And in the past few months, they have recognized the importance of justice and the importance of thinking about race and equity. And they've used those organizing skills that they have to expand into that space. But we talk a lot about the climate when I'm talking with kids.
So on your most recent mailer, I think I got it yesterday. I love the prescription, playing off of you being a doctor, prescription for the COVID-19 crisis. And there was a check mark about what does a federal and local public health infrastructure, like investing in that. So I was hoping that maybe you could actually explain what does that look like? What is a federal and local public health infrastructure? And also, how do things that happen on the federal level affect the local level? Because I think that's a big piece that's missing for a lot of people.
Yeah. Well, let's talk about what we have right now and where we are in this moment. So right now, we have a public health infrastructure that has been decimated over the past 10 years, really over the past 3 decades. But in the past 10 years, there was supposed to be a $10 billion investment in public health. And almost all of that money was stripped away by Republicans in Congress and by President Trump. And in the absence of that money, the CDC didn't have what it needed to make sure that they could coordinate a public health response. The National Institute of Health didn't have what it needed to make sure it could do the research in public health and in that space. The National Security Council didn't have what it needed to have an emergency preparedness task force ready to go if something were to happen. And we saw what happened in COVID, right? We saw that the lack of that public health infrastructure resulted in rapid spread of the infection, thousands of deaths, millions of infections. But we also have to recognize that the absence of that public health infrastructure is what is resulting in the opioid epidemic all across the country. It's what is resulting in the huge numbers of gun violence and deaths that are happening from guns every single day. It is what is driving, when we talk about the vaping crisis and the vaping explosions that are happening and the complications from vaping, that's all under the jurisdiction of public health. And so when I talk about a federal, state, and municipal partnership, I'm talking about the federal government being funded appropriately to build the public health infrastructure that it needs across all 50 states, across all of the cities in this country, so that if anything were to happen, COVID-19 or something happening in substance use or something happening with another infection that may come across our shores, that we can rapidly turn on all of these nodes across the country to react instantaneously and to come up with a plan that will stop it in its tracks. We should have been prepared for COVID. We should have been prepared for a pandemic, and we weren't in any way prepared for what came into this country and now has really devastated so many people.
Out of all of the districts that you've traveled to, what has been the area of greatest need? And what is that need, and how will you address it?
There are a lot of different needs in different areas of the district. I think I'll talk about Brockton because I do think there's a tremendous need in Brockton. There is a need for an investment in jobs in Brockton and infrastructure and transportation. Brockton could be an incredible, incredible city. They have 3 hospitals there. They have a ready and willing workforce. They have actually a fiber optic cable that runs all the way through the city of Brockton and could provide high-speed internet and tremendous data flow in and out of the city. They could be a hub for biotech and pharma, but they aren't because no one's invested in Brockton. And it's resulted in a city that doesn't have what it needs to sustain itself, right? That people aren't being paid the wages that they need in order to pay for the housing that exists. They don't have the transportation to get themselves to Boston or to other areas so that they can have those jobs. There's a huge need in Brockton, and I really want to come up with an investment strategy and an overall plan to lift up Brockton. But I don't want to take away from other areas of the district. I mean, when I'm on the South Shore and I'm in places like Scituate and Hingham and Hull, there are real immediate complications of climate change. They have one high tide and a bad storm, and roads get washed away. Houses flood. And climate change is real, and it is impacting those folks every single day. And so we have to move forward rapidly with a climate change plan. We have to address what's going on in this country because 5-10 more years, a lot of areas in Scituate and Hingham won't be habitable. People won't be able to live where they are right So there's a lot of needs, right? But I think it depends on where you are in the district.
Thanks. We're winding down a little bit, but we have a few minutes. If anyone has a question, we can take it. Just raise your hand. Oh. Okay, I'll ask more questions. I just wanted to make sure no one was lingering and missed the opportunity to get a chance to speak to you. You know, one of the things that I focus on a lot in maternal health is the lack of response and engagement. Once someone gets to DC, there becomes a disconnect to local communities. Mm-hmm. And so an example I'll give you is actually, I wrote to Stephen Lynch about a very serious issue several months ago, and I never heard back. Now, imagine if I, as a maternal health advocate, or you as a doctor, just didn't respond to a patient's needs, right? Like if a woman called me and she's in distress about postpartum mood disorder, wrote me an email that maybe she was feeling like she might hurt herself or her baby, and I just went, I'm going to ignore that one. What would happen to that person? So how will you ensure that every email gets read, every sort of communication, whether it's a tweet or someone in need, however they can reach you, whatever method they're using to reach you, how will you ensure that the message gets to you and that you're actually going to be able to address their needs?
Yeah. I want to say that I will read every email, I will read every tweet, it will all land on my desk, but I know, and you know this, from this, the volume is too much, right? And from running a transgender health program and running a campaign, I can't respond to everything, but it comes down to the team that you build around yourself, right? It comes down to those folks that work with you and work for you in your office, and making sure that what you described, right? As a physician, I don't have it, it's actually sitting in the other room, but I have a pager that I still have, right? And my pager goes off because a patient is in distress. And when my pager goes off, I answer the page. I call the patient back. I know that there's something that I have to address. When a patient sends me a message, I know that I have to call them. I know that there is an urgent need there. I will never give up that belief, that process. I need to make sure that the team I put in place recognizes that and feels that same thing, that every email that comes in gets a response. Every phone call that comes in gets a response. Every person in distress knows that they can go to somebody and they can get the access they need. They can get the care that they need. They can just have an ear to listen if that's what they need. So, right, sometimes it's not about doing something, it's about listening and making sure that everyone's voice is being heard. But it's about the team that you put in place, right? And it's not just the team that works really closely in the office, it's about the team that you build in the community, so that the people who may be too timid or too shy to call a congressional office, but maybe they'd call you and say, this is an issue I'm having, how do I get this addressed? That you know that you can bring that to me and we can work together to fix that problem.
Great. So just before we wind down here, Robbie, you obviously know you have my vote, and Bob Saba downstairs in the dining room, you have his vote. If our children could vote, you'd have theirs too. But we want to help get you over the finish line. So tell everyone here tonight, how can we help you? What are the opportunities left? What volunteer opportunities? How can you planning to vote? What sort of plans should we be putting in place to make sure that we show up on time? All that stuff. Let us know what you need from us to just help us get there.
Well, I'll say there are always volunteer opportunities for a campaign. Campaigns run on volunteers helping us get the work done. We have phone banks every single night, every single day. And as we get towards September 1st, we're going to be expanding our phone banks so that we can call people all across the district and continue to encourage people to vote for me, and then actually make sure that they did vote for me, so that we make sure we're getting our supporters to the polls. So that's a great way for people to help out. There's also ways to send text messages for the campaign. And there are ways for you to do some of your own outreach in your own network through this app that we have called Reach. And I'll let Nina send some details about that afterwards, so that people who maybe have friends and family and neighbors in the district, they can reach out to them to try to get them involved. We recognize the biggest roadblock on our way to victory is name recognition and getting me out there. And what I always say on these things is that if each person on this call told 10 people they knew about this campaign, we would very quickly be able to expand of name recognition and get a ton of people. So we're not talking about reaching out to 150 different people or making 300 phone calls. 10 people in your network makes a huge difference when it comes to election day. And then the one other thing I'll say is that for people who are in Massachusetts, in the district, and are concerned about voting and how to make sure that they're going to get their vote counted, in the next day or so, we're going to release some information on our website about ways that you can vote by mail, vote early, vote by dropping off your ballot, or if you're going to vote on election day on September 1st, how you can do that safely and where your polling location is. I think it's important for people to check before they go and to make a plan, because things are changing rapidly in Massachusetts right now.
Thank you so much, Robbie, and thanks everyone for joining. The last thing I want to say to people, just as an advocate for patients, for me, it's all about who do I feel like can represent my lived experience the best. Now, obviously, we look different. We're two different people. We come from two different worlds. But I do feel so comfortable, Robbie, knowing that you would be able to represent not only my voice, but the voice of so many women like myself, other parents like myself, just such a diverse group of people. And I'm so confident in your abilities, and I'm so excited to have had this opportunity to have other people get to know you in the way that I've come to know you over the last couple of months. And I think it's a real question of who represents me, my community, my family, my lived experience. And for me, I'm 100% all in Dr. Robbie, and thank you so much for taking the time to chat with us tonight.
Amazing. Well, thank you. You did a great job. We should have you moderate and host all of these.
Why not?
We'll bring you in. We'll bring you into the campaign staff.
All right.
Perfect. Well, thanks everyone for joining tonight.
Thanks everybody. Take care.
You all.